Hello, hi, this is Dr. Erica on Ebola, specifically Alzheimer's disease, and also the new medication that was recently approved this year, which is the lecanemab. Lecanemab is a fast, accelerated approved medication by the FDA this year, January 6th, because it has shown to be significantly decreasing the amyloid beta plaques that are specific for Alzheimer's disease patients, can be seen on imaging, and it has been found to significantly reduce those entities. So we are proud to say that this is the first of a new class of medications that shows that Alzheimer's disease in early stage and mild stage dementia can be uh, treated. So that is a very important milestone in medication therapy, pharmaceuticals, and in the medical field. So I am proud to be able to introduce this new medication. Lecanemab is the generic, and the brand name is going to be LEQEMBI, okay? And it's given at IV infusion, and that's going to be every 2 weeks to slow the pace of cognitive decline. The side effects can be infusion-related reactions, headaches, and also swelling or bleeding on brain sites or specific spots in the brain. Okay, it is not found to be cost effective as of right now. It is actually above the cost effective bracket. So right now, it is not very cost effective, but it is beneficial. Okay. Um, Again, it was approved on January 6th of this year by accelerated pathway, meaning that there was a surrogate or another endpoint that was found to be um, significant enough to go ahead and give that approval from the FDA. Okay. And also, there are other medications that are over the counter besides Prevagen. There is the Lion's Mane. There's also Nuriva that's out there over the counter. There are no significant trials that have pushed those items, multiple trials that have pushed those items to be available, but there's one particular one for each that has helped to have it on the market now. Also, there's DHA or decahexanoic acid, which helps to reduce cholesterol and protects the heart, and also protects the coronary arteries. That entity, decanohexanic acid, has been tried in clinical trials, but no significant data has been released to give its approval in the use of Alzheimer's disease patients. So do make note of that as well. Now back to our new drug, which is the lecanemab. It is given at 10 milligrams per kilogram body weight every 2 weeks for consecutive weeks. And in the clinical trial, it was given from baseline all the way up to 79 weeks against the placebo arm. And as we know, the placebo arm does not receive the actual medication. They may receive a water-based supplement or solution, but they don't receive the actual medication. So in the actual arm that did receive the medication, that is the LEQEMBI or lecanemab, that group of over 850 subjects with mild dementia or mild Alzheimer's disease did see a significant reduction in the plaque that is a signature of Alzheimer's disease. And so those patients did actually receive that medication and did show a imaging of a reduction in plaque. So we're proud to say that as of January 6th, we have a new medication to help treat Alzheimer's disease and mild dementia as well. Okay, so for Prevagen, I wanted to just make mention of Prevagen since I was a registered pharmacist working for a particular company here. People have always come in, ask for Prevagen, where is it located? Or make sure you have my Prevagen order in my bag. So Prevagen is over the counter, and it is a supplement. It comes in an extra strength and a regular strength, and it is derived from the sea jellyfish, actually. And it is derived from jellyfish, yes. So if you have allergic reaction to jellyfish, or seafood or any type of water based food product, do reconsider Prevagen. But Prevagen is over the counter still and is still on the market, and it is available, readily available. Okay, and it can be ordered also from the website of Prevagen.com that I visited as well. The FDA, just make mention, FDA is a agency under the U.S. Department of Health and Human Services that sets standards for cosmetics, drugs, medical devices, veterinarian medicine, also tobacco and nicotine products, and also any type of product that you apply to your skin or that you consume. The FDA is the approval on those items, except for over-the-counter items such as your supplements, your dietary supplements, and also your herbal supplements, I want to say as well. So the FDA has done a great job at accelerating the approval of this new medication, and I give it my thumbs up, and I hope you do as well. And do your research, and you do researching and looking out for what's important in taking medications. Last but not least, I'm going to mention that Alzheimer's disease is a disease that is characterized by loss of memory, loss of cognitive function, and is significantly characterized by a person needing around the clock attention and around the clock assistance with their feeding, with their clothing, with their daily living. So do make mention of Alzheimer's disease and what causes it. And some of those things that may cause it can be muscular injury, inflammatory processing. It could be loss of calcium regulation, defects in cholesterol metabolism, acetylcholine, cell depletion, which is a neurotransmitter, and those items are depleted and significant to Alzheimer's disease. Now, specifically, the like I mentioned earlier, the amyloid beta plaques and the neurofibrillary tangles in cortical areas of the brain and temporal areas, lobes of the brain structures are also indicative of these. So once those items have been found and have been confirmed, diagnosis uh, can be rendered at that time. So do 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 look into and research the disease state as well as what's out there on the market, what's new on the market, and what can be and how it can be treated, and the side effects versus the benefits of the medication as well. So I do thank you for joining me, and I'm glad I was able to bring forth this new medication topic on today, lecanemab, LEQEMBI, Alzheimer's disease, a new class of medications for treating Alzheimer's and dementia. And I have had vast experience working with the population of dementia and Alzheimer's disease. Glad to say that finally there's a group of medications that are out there and readily available. So thank you for joining me on today's topic, and I'm Dr. Erica signing off. Have a great day. Bye-bye.